The topic of this discussion is bunionette deformities. Most patients understand that a bunion is an enlargement on the inner aspect of the foot. On the outer aspect of the foot is what we call a bunionette. And either one of these can be associated with pain and discomfort with shoe wear. This is a photo of one of our patients with a large painful bunion. As you can see, it's on the inner aspect of the foot. Another patient, they develop pain on the outer aspect of the foot, and this is called a bunionette deformity. These can be painful and difficult for one to find comfortable shoe wear with this deformity. So when we look at a shoe like this with a high heel and a pointed narrow toe box, this is a setup for both a bunion and a bunionette. This, on the other hand, is a lower heel and it has a wider toe box, and sometimes this will accommodate the foot very nicely. And sometimes the deformities are just so substantial that a sneaker or tennis shoe is the shoe of choice for these patients. If you look at the alignment of the foot, there's often a widening of the bony structures in the forefoot with this type of problem. Now, bunionettes come in all kinds of shapes and sizes. There can be a large metatarsal head, as we see here in this example. There can be an outcurving of the fifth metatarsal bone, as you see here, or there can be just a substantial widening of the forefoot, as we see in this next example. Often the problem is a wide foot does not tolerate a narrow shoe, and finding shoes that accommodate the foot is a major goal. We often try to find shoes, as I showed you, with a lower heel and a wider toe box to afford adequate room for this painful deformity. Another example that I'll show you is using pads to relieve pressure over the bunionette deformity. Using these silicone pads that slip over the fifth toe, we can actually pad that prominence and alleviate pain. Another conservative alternative is to stretch the area in your shoes overlying the bony prominence. This usually is a leather shoe. Nylon doesn't work very well, but your local shoe repair shop can be a real ally in alleviating pressure areas in your shoes. And likewise, some of the time, patients develop a callus on the undersurface of the bunion, and this can be shaved and this can alleviate pain. Also, custom orthotics can be made that will alleviate pressure in this area as well. Shoe wear and orthotics are the most common means of conservative treatment for bunionettes. When this is really unsuccessful, surgical intervention may be indicated. Depending upon the deformity that's present, this will determine the recommendation for eventual surgery. So let's talk about surgical procedures. A simple bumpectomy or removal of the exostosis, we've now found out through our experience that this simple shaving of the bone just doesn't work. It's been tried throughout the years, and if you look at these x-rays, you can see it looks pretty good to begin with, but as we move from left to right, you can see that often it tends to recur. And we don't want it to recur. We want to have a successful procedure. So we've really eliminated just shaving the bone itself. Now, another procedure is called a distal osteotomy. Osteotomy means cutting of the bone. And sometimes we can narrow the outer aspect of the foot by cutting the fifth metatarsal bone, as you see here. Then we can move it inward. We usually fix it temporarily with pins or screws, as you see here. And we perform this surgery for less severe deformities. Now we move on to a midshaft osteotomy, and that's done in this region here in the bone. And we call this a more aggressive procedure because we find that we can get more correction at this level. In this situation, we make a longer incision and then we make an oblique cut, as you see in this diagram, and we rotate the bone inward. We also remove the enlarged bone and then repair the ligaments overlying the bunionette. We've actually followed up on several of these patients having this procedure. We've interviewed them and examined their feet a few years after their surgery, and we found these to be a very worthwhile procedure. Now let's talk about how we accomplish these procedures or surgeries. If you as a patient have a painful bunionette that's not responded to conservative treatment, surgery may be scheduled. It's typically done in an outpatient setting, and you'd go home afterwards and then be seen in the follow-up in the office a day or two later. The surgery is frequently done with the foot anesthetized or asleep. We call this a nerve block. Also, sedation is used so that a patient is unaware of the noise and other activities with surgery. Afterwards, the foot is wrapped in a bulky, soft dressing. At each office visit, the dressing is changed and rewrapped, and x-rays are usually obtained to ensure that the bones are healing properly. Pain control is obtained using oral pain medicine, which is typically used for a couple of weeks. Following surgery, a patient is allowed to get around using crutches, but often within 7 to 10 days, they'll just weight bear on their heel using a postoperative shoe. At a point 6 weeks or so following surgery, we usually allow a patient to get into a roomy sandal or shoe of their choice. Probably the final office visit occurs 12 weeks down the line if things have gone smoothly. By this time, x-rays usually show the bone to be completely healed. Bunionettes can be quite uncomfortable, and when shoe change, orthotics, and other conservative methods are unsuccessful, surgery may be the means to realign the foot and reduce discomfort, allowing increased activity and more reasonable shoe wear.